Hey guys, it's Jessica again. I wanted to cover a few more topics today. I'm on my Christmas break and I have 6 months left. Yay! I'm so excited. So now it's just the final stretch, and I definitely wanted to share a few things I learned with you to help you be successful in nursing school, and hang in there, you can do it. So today I wanted to talk more about the renal system and go over a lot of the main hormones that affect your fluid balance and your concentration levels. So the first one we're going to talk about is your antidiuretic hormone. So if you think about diuresing or diuretics, what do? Well, they make you pee. So if it's antidiuretic, it's anti-pee. So instead of diuresing and losing your fluid, you would then, with ADH, you would save fluid and hang on to it, keep it for when you need it. So if your osmolality is increased, let's say you're really dehydrated, you obviously don't, in your blood volume, you don't have enough fluid. Well, that would trigger ADH to get released. ADH comes around, it starts saving water and hanging on to it so that it can then come to homeostasis in your blood and get balanced. So if your ADH is low, whatever your ADH is doing is directly correlated with what your blood volume is doing. So if your ADH is low, your blood volume would be low, because instead of saving water and having adequate blood volume, you're peeing it all out. If you have too much ADH, you are saving onto too much water, so your blood volume is increased. You do have a risk also of developing SIADH, which is syndrome of inadequate ADH. Now, the way I like to remember it, that we learned in our class, if you think of it as syndrome of increased ADH, that will help you remember that if they have this syndrome, your patient's going to have way too much ADH, they're going to have fluid overload problems, and they're not going to be peeing very much. So you have a lot of complications and risks with that as well. So ADH is secreted by your posterior pituitary gland. It allows your kidneys to concentrate urine. So it is ADH directly affects your fluid balance. And with ADH, it increases the permeability of water, helps you save your water basically in the distal convoluted tubule and in the collecting ducts. So that's the main places where it's at. So the posterior pituitary gland will make ADH, it kicks it out, especially if you're like dehydrated or your osmolality is going too high, your fluid volume is low, it kicks it out to save that water and to help balance everything out. Now, the other counterpart to that is aldosterone. Now, aldosterone does not affect fluid balance, really, in the scheme of things. Aldosterone cares strictly about sodium. Now, remember my guy Al, aldosterone, I love this guy. He loves salt, right? So aldosterone, if he's got low on salt, doesn't have enough, he's going to go around and start collecting salt and saving it. The downside to that is, as he's collecting salt, he keeps giving his pot away, his potassium away. So sodium is increased, the potassium is decreased. They have a risk of then becoming hypokalemic. If their sodium level goes too high, they're giving their potassium away very rapidly, so you have to also watch for hypokalemia with aldosterone levels that are being increased. But aldosterone, he loves his salt, but he's giving his pot away. So remember that. That will help you know what is going on. So if they're dehydrated and let's say it's fluid overload and they don't have enough salt, aldosterone is going to get kicked out. It's going to start saving sodium. And as it's saving sodium and you're starting to excrete some of that urine and get more of a balance, the potassium then is going to get excreted, and there is that risk also of hypokalemia. So good old aldosterone, Al, he is released by the adrenal glands, which are on top of both your kidneys, and it acts strictly on the distal convoluted tubule. So whereas ADH works on the distal convoluted and the collecting ducts, aldosterone only works on the distal convoluted tubule, and he strictly affects your sodium levels and the excretion of your potassium. So let's see. The next one I want to talk about is ANP. So you have ANP, which is atrial natriuretic peptide, and your BNP, which used to be brain natriuretic peptide, and I'm not sure what it is now. We'll go over that. So your ANP, it is secreted from your right atrium, atrial. Okay, that'll help you out when you're looking at a test. It is those the ANP, the peptide, is released in response to fluid overload or stretch. So it's in the atrium of your heart, and when it senses that there's too much fluid, say in the case of maybe there's too much ADH and there's too much water and it's getting stretched too much where the heart's not working properly, ANP gets kicked out. It's a natural diuretic. It's going to help you diurese and help get that water off. And what it does is it inhibits renin and ADH, so it turns the ADH off in renin, so you can't go into your renin, angiotensin, aldosterone system. Turns this off, also suppresses aldosterone, says, hey dude, take a break. I need a break here. We're trying to get rid of some water. And it triggers fluid release. So in that case, when your ANP kicks in, your patient is going to have a large volume of dilute urine. It's not going to be concentrated because there's so much fluid there that is present that it's just getting rid of it. So it will increase the amount of sodium in urine as it's going out, but it's dilute urine, and they're going to pee like crazy with ANP. Okay, and in the past, I know you probably talked a lot about like erythropoietin. Erythropoietin is produced and released in response to hypoxia and decreased renal blood flow, and erythropoietin stimulates making of RBC production. So erythropoietin is released from your kidneys. And also with your kidneys, something else to think about, vitamin D also is essential for absorption of calcium and phosphorus. And it is necessary for that stuff, and it regulates the calcium and phosphorus levels and tells it when to absorb it in your GI tract. Now, the BNP, I wanted to talk about that as well. I don't have a slide right in front of me, but the BNP also is triggered by fluid overload and stretch. I think of the body's natural P as the words I created with the letters BNP, body's natural P. BNP also is triggered by a stretch, and it will cause you or your patient to diurese. So those are just a few of the hormones with the renal system, and I will cover a few other things, but hopefully that helps you kind of get them straight. And if you have any other questions, just leave me notes and let me know what you would like to see, and I'll make more videos. Thank you.